West Australians have done so well looking after each other and keeping ourselves safe. Police have only been required to hand out a very small number of infringements over the lockdown period. Just as an example, police have had to hand out 15 infringements in Perth and Peel over those 4 days. As a point of comparison, yesterday alone, New South Wales had to issue 125 infringements. So I just wanted to say thank you to Western Australians for doing the right thing. It's why we are in the strong position we find ourselves in today. This morning I can confirm WA has recorded no new local cases of COVID-19 overnight. Just to repeat, WA has recorded 0 new local cases. As an update on what WA Health has termed the Bondi-Mindarie cluster, 398 close contacts have been identified. All 398 have returned a negative test result. 2,815 casual contacts have been identified and 2,631 have returned a negative result. That's more than 93% at this point. It's important to keep checking the exposure sites listed online. New sites and times are added if and when they are found, so it's important everyone stays informed of the latest locations. Please also keep using the Safe WA app. Yesterday there were 1,355,898 check-ins. Please keep it up. 5,177 tests were conducted yesterday, which is not bad for a cold, wet weekend. Yes, however, we still need as many West Australians as possible to get themselves tested. Even if you've already returned a negative result, if you develop symptoms or your symptoms worsen, we need you to get tested again. It's telling that many of the cases in this cluster tested negative before eventually testing positive. These people were in quarantine for exactly that reason. They were already designated as close contacts, and that's why we test them multiple times. But for people in the community, even if you've already been tested once, don't hesitate to get tested again, especially if your symptoms worsen. The more tests we have, the more confidence we can have when taking the next steps. Getting tested is one of the best ways to keep each other safe and get life back to normal. Given we have recorded no new cases with a strong number of tests, we are confident we can move to our Given we have recorded no new cases with a strong number of tests, we are confident we can move to our much lighter transitional restrictions at midnight tonight as planned. In fact, we've received updated health advice from the Chief Health Officer to move to lighter restrictions than we announced at the end of last week. So from midnight tonight, Perth and Peel will be subject to the following light transitional restrictions. Masks will still be mandatory at indoor public venues, including in the workplace and on public transport. Masks will not be required outside where physical distancing is possible, or when undertaking vigorous exercise indoors or outdoors. People should still use common sense and take a mask with them whenever they leave home. There will be a 30-person limit in all homes for indoor private gatherings and a 150-person limit for outdoor private gatherings. High capacity will be allowed in venues, and that is, we will return to the 2 square metre rule and 150 patron limit for restaurants, cafes, pubs, bars, casinos, nightclubs, entertainment venues and public venues. However, in a welcome change, standing service will now be allowed. The 2 square metre capacity rule and 150 patron limit will also apply for beauty, nail and hair services. Public venues such as recreation centres, outdoor playgrounds, museums and swimming pools can open with the 2 square metre capacity rule and 150 patron limit. Indoor and outdoor community sport can resume with spectators. Fitness venues including gyms, Pilates, yoga, dance studios can open with the 2 square metre capacity rule and 150 patron limit. In encouraging news for many businesses, indoor and outdoor fitness classes will be allowed. Masks will be mandatory except where doing vigorous exercise. This welcome change is based on updated health advice. Weddings and funerals will be permitted for up to 150 guests. Outdoor gatherings can take place with up to 150 people without a COVID event plan. Places of worship can open with the 2 square metre capacity rule and 150 patron limit. A patient in hospital or a person in aged care or a disability facility can have 4 personal visitors per day. Masks are mandatory for staff and visitors. And major stadia, including Optus Stadium, RAC Arena and HBF Park, can operate at 50% capacity. Seated entertainment venues for performances at theatres, concert halls and cinemas will also be able to operate at a maximum 50% capacity, in line with our capacity for major stadia. And anyone who has been in the Perth or Peel regions since Sunday, June 27, but has since travelled to another region, must also wear a mask, subject to the above conditions. This is a safe and sensible step forward for Western Australia, and the result of West Australians doing the right things. Following the health advice, doing the right thing, using common sense, all for the greater good. While these are all encouraging developments, the threat of COVID still exists. I want to update everyone on a rapidly developing situation with a ship off the coast of Geraldton. The ship is an empty bulk carrier called the MV Emerald Indah, I-N-D-A-H. The Emerald Indah has a Singaporean flag and most recently has been in Indonesia and is destined for Kwinana. Last night I was informed that one crew member reported illness and his condition deteriorated quickly. Due to the weather, he could not be helivaced off the ship. Subsequently, the MV Emerald Indah was able to berth at Geraldton, and the crew member was taken to Geraldton Hospital and placed in quarantine. He subsequently tested positive for COVID-19 this morning. I'm advised he was managed with the appropriate infection prevention and control precautions, and I understand he was only attended to by fully vaccinated staff. He's been transferred to Perth today, and his case will be included in tomorrow's case numbers. While this is less than ideal, we want to reinforce there is no current health risk to the Geraldton community. All other crew members are reported as being well. We understand the ship is currently en route to Kwinana. However, it is my preference that the ship is turned around and leaves Australian waters. We're currently working with federal authorities to try to ensure the ship sails away immediately. This is the outcome we want, and it needs to happen. We will continue to receive updates on this fast developing situation, but it's a timely reminder of the risks, dangers and challenges this pandemic presents to the health of our community. With regards to Victoria, pending no further cases and the situation remaining the same, Victoria is set to move to very low risk at 12:01 a.m. Friday morning, which is the 9th of July. I'm sure this will be welcome news for many. West Australians should familiarise themselves with any restrictions imposed by Victoria on those travelling from WA. Moving to transitional restrictions tomorrow is a great step forward for WA. It means we move a step closer to pre-lockdown life. It means more things can happen safely. It means more businesses can reopen. We'll have more to say later this week, we expect, about assistance for businesses affected by the lockdown as we are more confident, as we become more confident we are through this situation. So I'll say that again. We'll have more to say later this week, we expect, about assistance for businesses affected by the lockdown as we become more confident we are through this situation. And the ongoing situation with the Emerald Indah will provide further updates later this week. Our thoughts are, of course, still with everyone in Greater Sydney, where authorities today confirmed an extra 35 local cases, which brings that state's total up to 312. So to everyone here in WA, it's important to keep up the good work. Your actions are making a difference. We're getting the results we want. Follow the restrictions, check in on the app, get tested, and of course, get vaccinated. Any questions?
On the Emerald Indah, so was the captain of that vessel asked to turn around and go straight back to Indonesia or Singapore or wherever and refused and just decided to go to Kwinana instead?
No, not as yet. So I learnt about that this morning. So what happened was last night, a crew member became ill. The ship was on its way to Kwinana. I'll explain the whole situation. The ship was on its way from the north to Kwinana. I think it's a grain ship. It's going to pick up a grain cargo. She reported a crew member unwell off Geraldton. There was no capacity to helivac because of the seas, as you know, it's pretty rough out there. And so she had to sail into Geraldton Harbour, where the crew member who was unwell was unloaded. I'm advised, everyone wearing the appropriate PPE and all of the safety measures in place. He's placed in quarantine at Geraldton Hospital. He's been tested for COVID-19. He's been found to be positive. The ship has now sailed from Geraldton. Our view, as we have expressed before with these cases before, is the ship should sail away. Obviously, if the ship comes to Kwinana, it poses a risk we don't want, and so we've requested to federal authorities who control these things that the ship sail away as soon as possible.
How many crew are on board that ship?
It was 22 crew members, and I'm not sure if that includes the sailor who's been taken off. I think it'd currently be 21.
How old is that crew member and how ill is he?
I know he's ill. I know he's been very ill. So he has come off and he's been medevaced from Geraldton to Perth. He's in hospital here. I don't know which hospital, with all of the appropriate measures around him. But he's quite ill, and so we're managing that situation as best we can.
Do we know where the MV Emerald Indo is at the moment? Has it left Geraldton on the way to Kwinana? Do you know where?
Yeah, she sailed from Geraldton. Apparently she's somewhere out there between Geraldton and Perth.
How frustrating is it that the community can do everything that is required and we can get back on track seemingly, and then we have a situation like this that could come again? In no fault of the community could come in and pose an unnecessary risk from Kwinana and Geraldton.
Well, this is the world we're in. This will keep happening until everyone's vaccinated. So once everyone's vaccinated, well then we can be much more secure and much safer about these sorts of things. But we are an open trading economy. We trade with the world. We have people still come in from overseas, returning Australians and the like, and air crew, so there's always the risk. The outbreak that occurred in Sydney there a couple of weeks ago that came from Bondi to Western Australia, it was no one's fault. We didn't do anything wrong. It's just the world we're in. And so that's why we keep saying to people, please, as soon as you can, get vaccinated.
What powers does the government have on refusing the ship berthing at Kwinana?
It's a Commonwealth decision, largely, so it's under the control of the Australian Maritime Safety Authority. And our view is, and we're working with them to get the ship to turn around and sail away.
Do you expect that there'll be more cases if this person's quite
We
ill?
don't know. We don't know. He's very unwell, apparently, so probably quite infectious, so that's why the safest measure to deal with this situation is for the ship to sail.
Is that
And just so you know, we've done this lots of times. We've done this, to my memory, 2 or 3 times before, where we've got the ship to sail. So that is the safe, and you might recall with cruise ships back in about a year ago, a bit over a year ago, we had about 8 of them heading our way, and we got them to sail. So that's the safest way for us to deal with this situation.
Just to
in terms
clarify,
of
if you...
the Commonwealth agency that gave it the go-ahead to berth in Geraldton?
Well, that's an emergency situation. So I think we allowed the ship to come in. That was an emergency. So she pulls in, we unload the crew member, she sails away. But for her to sail now down to Perth, we think is an unnecessary risk. So we're requesting that the ship sail away.
Just to clarify, if you've travelled to the regions from Perth, you're now from tomorrow morning able to go back to the hospitality venues and...
That's right, but you've got to wear a mask. So the mask rule is in place for people from Perth who are out in the regions. We think that's a fair and reasonable measure, and we just urge everyone to wear the mask when they're in the regions.
Will that business assistance, will that extend to tourism operators that didn't see the crowds that they usually would?
Well, we'll announce whatever we're going to do later this week, we expect. What I can't do is announce a business support package, then we have a further outbreak. We want to make sure we've dealt with this entire situation completely before such time as we announce our business support package, because otherwise, if we go back into some form of lockdown, which is always a prospect, whatever we announce would be perhaps not enough. So that's why we want to make sure it's all resolved before we announce it.
And in terms of support for individuals, has the Commonwealth Government now ruled out any kinds of payments to workers that must start on work during the lockdown, which is only 4 days rather than the minimum 7 days?
They haven't responded. I wrote to the Commonwealth on Friday. Obviously, we've had 4 days lockdown, 3 days interim restrictions, and then 7 days of reduced restrictions. So we're asking whether or not they'll accept that they can support people, particularly casual workers who have lost income, with their measures. So clearly they'll do it for New South Wales. What are they going to go through? 2, 3, maybe 4 weeks of lockdowns? Who knows? So clearly they'll do it there. But here we have a sort of a hybrid case, if you like. So we've asked, and I've asked directly, that they consider providing that support. So we'll wait and see what they say.
For businesses who applied and were approved for an assistance package from April's lockdown, do you know if they've all been paid so far?
I know thousands have. I don't know the exact figures of how many have at this point in time. Obviously, it was an application process, so some won't have been accepted for whatever reason. But I know many thousands have. That's why, especially, you know, the world we're in, I don't want to have to keep on doing this. That's why I want everyone to get vaccinated. So the sooner everyone is vaccinated, the sooner we can get out of this zone that we're in of having to lock down, having to have business compensation packages, having people get sick and potentially go to hospital. As soon as we get everyone vaccinated, the world and Western Australia's safety and security will become much better.
How many GPs will be involved in rolling out the Pfizer vaccine that was announced today here in WA, and from when?
I'm sorry, who announced what?
With the Pfizer vaccine, and GPs allowed to administer the Pfizer vaccine to 40 to 59-year-olds. It's about 500 GPs across the country.
That's a Commonwealth scheme. I don't have those details, I'm sorry.
On Monday, is it correct we move to phase 5? Would that include Optus Stadium returning to 100% capacity?
Yeah, today week, that's the expectation.
And
So,
then-
sorry if I can just finish. So expectation is today week, we'll head back to what was termed phase 5, which is basically normal life.
And that would be a football game, Eagles versus North, continuing at Optus?
Yes, football games will be back on, so that will be wonderful, and I hope we do better. And so that will be coming as of Monday week. In the interim, of course, it's half crowds, so between now and then it's 50% capacity. And I want to also add, we've also ensured that some of those, shows at the theatres and especially cinemas can have 50% capacity. So the great news for cinemas, and I have a lot of sympathy for cinemas after what they've been through, is they can get back to 50% capacity immediately.
These lighter restrictions, they're even more so than what was anticipated on Friday, right?
Correct.
Why is that change in thinking?
Oh well, the chief health officer has had a look at our situation. So our situation is very, very strong. So on the basis of that and what's occurred over the course of the last 7 days, we've been able to have more relaxed restrictions in place as of tomorrow morning than we were anticipating last Friday.
Given the number of new cases in New South Wales today, would you be disappointed if they pushed ahead with ending lockdown on Friday?
Well, I'll let them make that decision, but obviously they're in a pretty difficult position. They keep getting large numbers of cases, and as you know, if it gets away from you, you're going to have a very, very dire situation. I understand there's a bunch of people in intensive care now in New South Wales. I think it might be 5 or so. So if you do the maths on that, if you have thousands of people who are positive, you think about the numbers of people in intensive care and how the hospital system just won't cope. So my view is always with these things, be cautious, try and get rid of the virus, get back to normalcy, but don't skimp. Don't skimp. If you skimp and it gets away from you, well then the situation could be far worse. And indeed, as we know, it can transmit between states because that's what's happened. So it's good for all of us if New South Wales is able to crush and kill the virus.
We're hearing
TGA
reports.
is looking at approving Pfizer in use for 12 to 15-year-olds. Do you think that's a good idea, vaccinating kids from 12 up?
Well, eventually that's what we'll have to do. So I understand I might have said this the other day, there's been studies overseas about the efficacy and the like for vaccination for kids. So that's a process that's ongoing, but eventually we'll have to get to a situation where kids perhaps of that age are vaccinated or given the opportunity to be vaccinated. So that's the road ahead. So the sooner we get as much Pfizer as we can, the sooner we get it into people, the sooner we make it available to over 60s, the better off we'll all be.
I'm hearing reports that patients flying in from the Royal Flying Doctors Service are having to wait at Jandakot for hours due to the ambulance ramping. Have you heard anything about that?
No, I
And does
haven't.
that sound alarming to you?
Well, sometimes there's a range of reasons. I don't know what the reasons are. So sometimes I don't know if it's weather related, what it is. But we'll just, we're doing our best. Obviously, our hospitals are under a lot of pressure, as the Health Minister has regularly said. The increase in presentations at emergency departments is at all-time highs, and particularly with people with multiple conditions. And some of that is a delayed reaction, we think, to COVID, because it's happening all over Australia.
Given that we're down a couple of hundred of nurses across the state network, has the government's recruitment campaign failed to get nurses?
Look, some nurses are off because they're unwell. So what's occurred is the directive inside hospitals is if you're unwell, please don't come to work for obvious reasons. So, you know, nurses with colds or coughs or whatever it might be are obviously taking time off. So that's putting pressure, additional pressure onto our hospitals. We're recruiting 1,000 nurses this year, 1,000 nurses next year. We have the biggest health budget per capita of any state in Australia. So we're doing as much as we can to get more nurses on board.
Does that include bringing them from other countries?
Well, not at this point in time because we have closed borders. So what we're doing is opening up for more nurses who are overseas trained, who are currently living in Australia, to make them available for our health system. So that's one of the things we're currently doing.
The ANF say that the recruitment drive has been catatonic, and Mark Olsen hasn't seen any evidence of an actual recruitment drive that was promised back in April. How do you respond to those comments?
Catatonic?
Catatonic, yeah. Subdued, I guess.
Odd. Look, not the word I would have used, but in any event, look, we're doing all we can to recruit nurses into our system and make sure that we train more nurses here in Western Australia. So a whole range of programs we're putting in place to do that. It's actually, to the best of my knowledge, the biggest nurse recruitment campaign in history. But we are to a degree hamstrung because overseas nurses, and there are at any point in time many, particularly from Britain and India and places like that, we can't recruit them at the moment. So that is obviously putting added pressure onto our system.
Are they not exempt? Are nurses being, are they not exempt to bring in medical staff from overseas?
No, we have caps. So it's only for the most, you provide additional spaces above the cap only in the most, in very exceptional circumstances. So look, as we've seen, look at Sydney. Every time you up the number of people arriving, you increase the risk, and look what happens. So it's just one of those difficult situations we're currently going through.
On the Commonwealth's plan to have residential aged care workers have their first dose by mid-September, is that rollout just too slow?
I'm sorry, I missed that, Eliza.
The residential aged care workers, mandatory vaccinations will be by mid-September, at least their first dose. Is that moving too slowly?
No, it's not. It's practical. So I actually agree with this. It's practical. And you've got to also make sure we have enough time for people to do it and opportunities. So, we want, if these people who work in aged care, who are actually quite heroic, they're great people, and I don't know if you've been to aged care facilities and met many people working there, they're lovely, decent human beings. We want to make it available at our clinics for them to be able to come and get injections in our clinics. I think there's actually a program whereby they can get some priority, particularly in the morning, if they want to come and get vaccinated at our clinics. So look, we just got to have a time frame to phase it in, but over that time frame, we expect and hope that they'll all get vaccinated.
Just on the plans for a quarantine hub, standalone quarantine hub, there's two sites in consideration, Perth Airport and Jandakot Airport. Do you have a preference?
No, I don't. Both have upsides. They're both next to an airport. But this will be a joint decision between the state and the Commonwealth. But frankly, it's more their decision than ours because they're the ones building it. So if it's Jandakot or if it's Perth Airport, I don't mind.
Do you know how many Pfizer doses have been wasted? Because I am
very few.
Yeah.
Very few. What happens is, I think this is the case with any drug, is sometimes some aren't used because they're left out of the fridge for a while for whatever reason, or sometimes in the little vials, not every drop is used, when they put the syringe in and take it out. I think there's technical reasons why you can't use every single bit of it. I think it's about 1%. The advice I've been given is it's about 1% hasn't been used. I mean, that's just normal practice. I understand it's been, I think, is it the Liberal Party's been criticising it? Is it them? Yeah, it wouldn't surprise me that they're out there criticising, but I know our nursing staff and our doctors and our clinics and all of the people involved have been doing their best to make sure it's all used as efficiently and effectively as possible.
So what about vaccines supplies? New South Wales Health Minister reckons the supplies are so low that it's like people are chasing jabs like characters in the Hunger Games films. Is it getting that desperate around the country, you reckon?
I think I don't know if he's ever watched the Hunger Games, but that's not what people do in the Hunger Games. They do quite the opposite. Look, just in terms of the situation here, is we've kept some in reserve so we can have enough for second doses. So we're very comfortable about our supply at the moment, that we have enough going forward, and we're advised that more will come on stream in August in large numbers of Pfizer. So we're very keen to make sure that as many people get vaccinated as possible. Please get online, please make your appointment, please contact your GP. If they're able to, just get yourself vaccinated.
Is that the bottleneck in the system though? We just don't have enough Pfizer vaccine for the amount of people that would get it if they could?
Oh, well, that obviously it'd be great if we had more, and we'd be able to open up more opportunities, and pharmacies and GPs and the like more able to issue Pfizer. But we have certain supplies at this point in time. But I understand some states are running lower than Western Australia. I think perhaps we've sort of spaced ours out and allocated ours in a more orderly way.
Just to clarify, so you're saying the advice you've got is that about 1% of Pfizer doses that have been administered so far?
I don't know if it's Pfizer or AZ or a combination of both, but I've been advised it's about 1%. But I think that's not unusual. You know, I'm not a nurse or a doctor, but you know, when you're using these drugs, the advice I have is about that, and that's not unusual. I mean, I know some people look to criticise, you know, the opposition looks to criticise, they look for things to criticise. That's what they do.
Will the government consult with AMF in the short term to basically try to solve the nursing recruitment issues then?
Well, we're doing everything we can to recruit more nurses. We're employing more, we're training more, and we've allocated much more money towards it. So we're doing everything we can, but bear in mind we have some restrictions on international nurses coming in.
Last question.
Just to clarify, the ship member, the crew member, has that person arrived in Perth or is on its way? He's on
I
its
think
way?
he has. I was told this morning he was either on his way, about to be on his way, so that was a few hours ago, so I'd expect he's already here. He's gone to one of our hospitals, I'm not sure which one, but he's in quarantine. The staff all know that they have to wear the appropriate PPE and the like. They're very well trained and all that, so managing people with COVID is something we're experienced at now over the last 18 months, so I just hope he's okay.
Thanks, everyone.
Thank you.
Thanks very much.